let me show you the final variable, which is very, very important when we do any kind of aesthetic dentistry, and that is texture. Texture or surface morphology, which none of them give a thought about it, okay? Please remember, if your restorations are flat like a national highway, it will look fake, because it is all about light, okay? When light strikes on the tooth, 100% of the light should not reflect back in the same direction. This is a fake restoration. But when light strikes on the tooth, the light should go back in different directions. That is aesthetics. This is surface morphology. This is all about textures. Tooth is not flat. Tooth is concave and convex.
This is natural, this is artificial.
Absolutely, absolutely. Nobody in this world can make out you have done a veneer on this. But anybody can say something has been done on this. Yeah, yeah. This will take your restorations to the next level, okay? So let me tell you how you read textures. Again, what is important is you have to read, you have to get all the information from the tooth before you duplicate it. The problem with us is we don't read, we don't get any information, we do everything as per what we want.
We feel only, but we
are not restoring. We are not restoring, absolutely. So if you have to read textures, you can read only from certain angles on your patient. One is this view. I will come from this side, proximal view. Okay? Other one is 12 o'clock view. So I go behind the patient and I check. And the other one is 3 o'clock position. So 3, 9 and 12. You cannot see anything from the straight. You cannot see like this. When I look at the patient like this, I cannot see anything. What I see is, I see only, see here, see this patient. Beautiful set of teeth. If I have to plan anything on her, I have to read this tooth really well. And if I am looking at a 6 o'clock position, I see only the line angles. Can you see the line angles?
Yes.
Line angle is a surface where the light will reflect a lot. If I take a picture, you will see the flash light only at that line angle. But I don't see anything else. Am I right? The moment I change my angle, I come to the side of the patient.
9 o'clock.
You see? Now what do I see?
Texture.
The textures.
Beautiful depressions. Can you see the depressions?
Yes.
Wonderful. See this. These are two depressions, mesial and distal. This is there in every patient. Every female young patients. I'm sure most of you would be having this here. If you're doing a PFM crown, ceramic crown, zirconia, composites, please tell your technician to give this and then see the restoration. But tell me, how many of you tell no? Except for A2, we don't tell anything. It's not the mistake of technician, it's the mistake of operator. So now when I come and ask the patient to open the mouth, you see beautiful vertical ridge, see the depressions, see the pericymata. So what does this tell you? Tooth is not flat. You got to read. And once you read, you can give all this when you do composite veneer or ceramic veneer. You can do anything. But first read them, okay? See here, when I cross-polarize it, this is called cross-polarization. Take a picture from your iPhone or smartphone, Android, reduce the contrast and brightness. You reduce the light. Can you see the textures? Beautiful.
Beautiful.
And this is exactly what you need to give. So every patient have these kind of textures. So know the basics. It could be a primary plane. These are primary characteristic feature. Primary plane, developmental lobes. These are horizontal grooves running like this. Transitional line angles, developmental grooves. These are vertical grooves. Not necessary that one patient have all four. No. One patient might have maybe this and this combination, or he can have this and this. He can have this, this and this. It's like you need to read. But line angles will be there in all the patients. Okay? Most of the young patients. You could also see, so what I do when I finish my composite veneer, when I finish my finishing, if there is primary plane, I take a pencil just before polishing. Mark the primary plane. This is an undulating wavy depression. Mark it. Then take your finishing burr, or you take your finishing abrasive and just move in a slow speed. Remove a little bit of composite. You will get the depression. That's all. Okay, I will show you in the demonstration how to do this. And of course, what you saw on the other patient was developmental depression. This one. This is very, very common in female patients. Two depressions. Just draw it like this and take and rub it. I will show you this, how to do this. It's very easy. You can get this on the surface. But you will do all this just before polishing. Then I will polish. So finishing, then texture, then polish. A high texture case. Yeah, let's look at this. For example, this patient comes with a very poor restoration. Can you see? This dentist has used only enamel. Can you see? Only enamel, because he was not aware. This is the problem. He has the composite enamel, but he doesn't know it is enamel. He thinks it's body. That's why please see your inventory. So now this patient says it looks very, very translucent, very grey. So now what I do is I put rubber dam, and can you see the textures in this patient? Can you see the lobes running? See the depressions? Can you see all that? I have to mimic this. So what I do, I remove. It's a typical class 4. If you want to make your class 4 angle build-up invisible, how many of you get the demarcation line? After you finish, you see that line? Patient will say, doctor, this is filling, this is tooth. You see a line. You should not see that line. Why are you seeing that line? That means something is wrong with your technique. You can make these restorations look invisible. Let me show you how you can do this. So usually all class 4s, you should give bevels. You should prepare the tooth very well if you want to make it invisible. So you have to give 2 aesthetic bevels. How many? 2, not 1. 2. Aesthetic bevels on the labial. Lingual, you don't have to give bevel now. Earlier we used to give because the bonding was not that great. So we used to give a chamfer, but now not required. It's only butt joint. But on the front, you have to give 2 bevels. What's my first bevel? It's a long bevel. Take a needle chamfer burr, 2 millimeters wide, 2 millimeters wide. The first bevel is a long bevel at 45 degrees. Keep the burr at 45 degrees. Go from mesial to distal, 2 millimeters wide, 0.5 in depth. 2 millimeters wide, 0.5 in depth. Is it very clear? Yes. Now when everybody gives this bevel, you get a straight line. Can you see this line? This is the line you need to break with the second bevel. Because eyes can see whatever is straight. Eye cannot see whatever is curved or scalloped. Is it very clear? So now after this, I mark my second bevel. So long bevel is already there. I mark a pencil, take a pencil, place a curved bevel over the long bevel. Did you understand? Are you with me? See, when you give long bevel, you will get a line, correct? 45-degree plane, you will get a line. That line, over that line, you give this bevel. Curved bevel, or like a star. You can do anything, but break that line.
Marking line, demarcation line.
Demarcation line, you break it.
Confuse the eye.
Now once I give this scallop bevel, I can use a disc, soft flex, or I can use a burr. And now can all of you see the scallop bevel? So now my composite and my tooth is meeting in all directions. Now I will confuse my eye. It will not see where is the demarcation. Is it very clear? You don't stop here. There is a third trick. What is the third trick? After I give my bevels, what I will do? I will etch. Correct? I will etch. Most of them usually etch only till the bevel. That is wrong.
All sides.
You will go 2 millimeters beyond the bevel. I will etch till here. So now what happens is my enamel composite will go overlap the bevel and it will meet in a seamless margin. So now nobody in this world can make out your line. Are you getting my point? I think most of you are not doing this step. You need to over etch and your composite should overlap the bevel and merge here nicely.
Need to show the div. Need to show.
I'll show. Is it very clear?
Yeah.
So these are the steps you follow for class 4. Okay. So long bevel, scallop bevel, over etch, bond, And now I do freehand, okay? I do freehand.
So you can use the collar mic.
Oh, my collar mic is working or not? Oh, it fell, huh? Okay, okay. That's why I was wondering.
Sir, assess. Pura mic.
Okay. So now for class 4, what is my challenge? I need to get my lingual plane. My first increment will be from the lingual side to get my lingual wall. So I use my composite like a ball. I place it from behind and I keep pushing my composite with my instrument. It comes front like this and I create a lingual wall. This lingual wall is created with enamel shade because what is behind is enamel.
Yes.
Only 0.5 millimeters enamel. Once I cure this completely, I will place my body. Can you see my body?
Yes.
It is variable. It is thick here, and as I come down, I reduce the thickness. Please follow every procedure you do. You have to vary the thickness. Whether it is a veneer or a class 4 or a class 3, you have to vary the thickness. Okay? And then I give my lobes. Once I give my lobes, the mammalions, then I place my final enamel. I merge it nicely beyond the bevel, and now I mark my textures after finishing. So you mark like this with pencil. Can you see? You see here first on the natural tooth. You trace it first. On the adjacent tooth, you trace it. Once you trace it, you know what is there on this side, correct? Once you see, you replicate the same on this side. That's it. This is called tracing. You see what is there on the adjacent tooth, mark that. Once you see, you put that on the other side. And now with your burrs or your abrasives, you remove a little bit of composite in the same area as you have marked. You see? And then you remove it and see now I got the depressions and the lobes. And then I'll polish
No mark
it.
demarcation line.
And there's no demarcation line. I'll polish it and I'm done. You see?
Just putting natural anatomy.
Very natural. Now this patient says, wow, this looks like a tooth. Okay? Everybody can do it, not a problem. You see? Composite veneer. Old veneer. He is a dentist. He is a prosthodontist. He could have easily got a ceramic veneer done. But you see, he wants to save his tooth. That means minimal invasive concept is there in his mind. But at the same time, he's not happy because the composites are getting discolored every 3 to 6 months. Now, who is at fault? Is it the operator or the material? It's the operator, because he's not finished and polished well. What has this operator done? Usually you see how most of them finish and polish composites. Once they finish composite, they will use one red ring burr, go once or twice like this, then they'll take bonding agent, apply, light cure, show the gloss to the patient is very happy, and it's done. This is not how you do. You cannot apply your adhesive on the polished or the finished surface of your composite. Never. Why? Because all your adhesives have fillers in it. Please remember. Okay, your surface is not very smooth, and you're adding still more a rougher adhesive which has fillers in it. So the surface is getting even more rougher. And now this resin will stain over a period of time. So never do that, okay? So we did a beautiful composite veneer in this case, and what we did in this case was edelweiss veneer. You see, we removed and we placed the veneer so quickly. I finished this in half an hour, which I will show you the concept today. And this is exactly how the veneer is. So completely prefabricated system. Just roughen and place this veneer on the patient's mouth. The advantage with this system is the veneer is already polished and characterized. So you don't have to touch the surface. There's no finishing and polishing required with these veneers. But in case if you want to give additional textures, you can give textures and you can repolish them, because it's all composite. Okay? So now this guy is extremely happy. Never used to smile. Now he's got very good veneers. This will not stain now. Okay?